Mercury poisoning, signs, symptoms, and how to protect yourself. Welcome to Primetime Health. Mercury is a toxic metal that many people encounter without even realizing it. From everyday items like thermometers and light bulbs to consuming high mercury fish, the risks are closer than you might think. Today, we're uncovering the signs and symptoms of mercury toxicity, the different types of mercury exposure, and how to protect yourself and your family. Let's dive deep into this vital topic to understand how mercury affects your health and what you can do to stay safe. Number 1. What is mercury toxicity? Mercury toxicity, or mercury poisoning, occurs when harmful levels of mercury accumulate in the body. Mercury can enter the body through ingestion, inhalation, or skin contact, causing a range of health issues. There are 3 main types of mercury that can lead to toxicity. Organic mercury, found in fish, coal-burning emissions, and certain antiseptics. Inorganic mercury, found in batteries, some disinfectants, and the natural mineral cinnabar. Elemental mercury, found in thermometers, fluorescent light bulbs, and dental fillings. The severity of mercury poisoning depends on the type of mercury, the amount of exposure, and the duration. Symptoms can appear suddenly or develop gradually over years, making it crucial to recognize the signs early. Number 2. Common symptoms of mercury toxicity. Mercury poisoning can affect multiple systems in the body, leading to a wide variety of symptoms. Common signs include headache, shortness of breath, nausea and vomiting, metallic taste in the mouth, visual disturbances. Other symptoms may include abdominal pain, diarrhea, increased salivation, and even fever. The presentation can vary significantly depending on the type of mercury exposure and the individual's age and health status. Number 3. Symptoms of organic mercury toxicity. Organic mercury is commonly found in methylmercury, a compound present in certain fish and seafood. Long-term exposure, either through ingestion or skin contact, can result in a range of symptoms, including shakes or tremors, numbness or pain in the skin, difficulty walking, double vision or blindness, memory problems, seizures in severe cases. Methylmercury is particularly dangerous because it accumulates in the body over time, making even small exposures potentially harmful in the long run. Number 4. Symptoms of inorganic mercury toxicity. Inorganic mercury is often found in household items like batteries and certain disinfectants. This type of mercury is highly toxic if ingested. Symptoms of exposure include burning sensation in the stomach and throat, bloody vomiting, severe diarrhea. If inorganic mercury enters the bloodstream, it can lead to kidney damage, brain damage, and potentially fatal fluid loss due to diarrhea and kidney failure. This type of exposure requires immediate medical attention. Number 5. Symptoms of elemental mercury toxicity. Elemental mercury, commonly found in thermometers and light bulbs, is usually not harmful unless it turns into vapor. Inhalation of mercury vapor can lead to acute and chronic symptoms. Acute symptoms: metallic taste, difficulty breathing, vomiting, and swollen gums. Chronic symptoms: permanent lung damage, long-term brain damage, and in severe cases, death. Even small amounts of inhaled mercury vapor can accumulate in the body over time, making it important to handle items containing mercury with care. Number 6. Mercury toxicity in children and pregnant people. Children and pregnant individuals are particularly vulnerable to mercury poisoning. Pregnant individuals. Mercury can cross the placenta, exposing the developing fetus to methylmercury. This can severely impact the baby's nervous system, leading to developmental delays in cognitive thinking, memory, language, and fine motor skills. Infants and children, exposure through breastfeeding or environmental sources can result in permanent neurological damage, affecting motor skills, vision, and spatial awareness. Healthcare providers recommend avoiding high-mercury fish, such as swordfish, king mackerel, and tuna during pregnancy, and limiting fish consumption in young children. Number 7. Symptoms of chronic mercury. Toxicity. Chronic mercury toxicity can develop over years of low-level exposure. The symptoms are often subtle and may mimic other conditions, making it difficult to diagnose. These symptoms include skin rashes, chronic diarrhea or gastrointestinal distress, metallic taste in the mouth, difficulty breathing and persistent cough, swollen or bleeding gums. Chronic toxicity can sometimes resemble autoimmune or systemic inflammatory diseases, leading to misdiagnosis without proper testing. Number 8. How mercury affects the nervous system. Mercury is a potent neurotoxin that targets the brain and nervous system. Neurological symptoms can include tremors and muscle weakness, memory loss and difficulty concentrating, irritability and mood swings, seizures and cognitive impairments. Long-term exposure can lead to permanent brain damage, particularly in children whose nervous systems are still developing. If you suspect mercury exposure, seek medical evaluation immediately. Number 9. When to seek medical attention. Mercury poisoning is a medical emergency. If you suspect exposure or experience symptoms such as shortness of breath, vomiting, or neurological disturbances, contact a healthcare provider or go to the nearest emergency room. For immediate guidance, call the Poison Help Hotline at 1-800-222-1222 in the United States. Number 10. Questions to ask your healthcare provider. If you think you've been exposed to mercury, consider asking your doctor these questions. Could my symptoms indicate mercury toxicity? What tests are available to confirm mercury exposure? What treatment options are available? How can I minimize my risk of future mercury exposure? These questions can help you better understand your condition and take steps toward recovery. Number 11. Preventing mercury toxicity. Prevention is key when it comes to mercury poisoning. Here are some practical tips. Limit high mercury fish. Avoid swordfish, shark, and certain types of tuna. Handle items containing mercury with care. Properly dispose of thermometers, light bulbs, and batteries. Choose safer alternatives. Opt for digital thermometers and LED light bulbs. Educate yourself. Be aware of products and industrial emissions that may contain mercury. Number 12. Treatment options for mercury toxicity. Treatment for mercury poisoning depends on the type and severity of exposure. Chelation therapy. This involves the use of medications that bind to mercury and help remove it from the body. Supportive care. This may include fluids, oxygen, and treatment for organ damage. Long-term monitoring. Patients with chronic exposure may need ongoing neurological and renal evaluations. Early detection and treatment are critical to preventing long-term complications. Number 13. Mercury in the environment and everyday products. Mercury is present in many everyday items and industrial emissions. Common sources include fish and shellfish contaminated with methylmercury, fluorescent bulbs and thermometers containing elemental mercury, coal-burning power plants releasing mercury into the air. Being mindful of these sources can help you reduce your exposure and stay safe. Outro. Thank you for joining us on Primetime Health. Mercury toxicity is a serious health concern, but understanding the risks and symptoms can help you take proactive steps to protect yourself and your loved ones. If you found this video helpful, please give it a thumbs up and share it with your friends and family. Don't forget to subscribe to Primetime Health for more insights into important health topics. Let us know in the comments. Did you learn something new about mercury toxicity today? Until next time, take care and stay healthy.